Dr. Peter Johnson, an Aurora Baycare gynecological oncologist. We've heard so much in the news just from yesterday about Angelina Jolie and her decision to have kind of preventative cancer surgery. Tell us, what she did and why maybe she chose to do that.
What she did, she had a risk-reducing surgery. It reduced her risk from about 40 to 50% down to about 5%, her risk of developing ovarian cancer. So it's risk-reducing, it doesn't eliminate. The reason she had it is she was at very high risk for developing ovarian cancer. In fact, her mother developed ovarian cancer when she was 49 and died when she was 56. So Angelina is now 39, and she had some tests which were worrisome for possible early signs of ovarian cancer. Luckily, it was negative. But she had a surgery which done as an outpatient through little tiny incisions, went home I think the same day.
So this gene that everybody keeps talking about, can you kind of tell us about this and how it maybe, shows signs that cancer may be in the future?
It's called BRCA1, and people that should get this test done are people who have family history suggestive of this. Certainly every patient with ovarian cancer, it's recommended that this test be done.
Are there any other types of cancer you can do something like this, that there's some red flags?
There's a number of different cancers.
Okay.
For instance, colon cancer, there's a test. For breast cancer, ovarian cancer. Yeah, but this is the most prominent one because, as you know, breast cancer is one of the most common cancers in women.
So you have this test here, and you were saying people with a history of family cancer, of ovarian cancer, anybody else that should, talk to their doctor possibly about getting this kind of test?
Absolutely. If you have a mother who died of ovarian cancer, obviously she can't get the test anymore. If you have two first-degree relatives, mother, sister, two sisters, absolutely. A male in the family that developed breast cancer, very high chance they'll be positive for this.
And it reduces your risk by that much of developing cancer.
Absolutely.
And you were saying, what, 40 to 50% in her
40 to
case?
50% in her case. The other gene, there's called a BRCA1. That's what Angelina had. There's a BRCA2, and that you'd have about 10 to 15% risk versus the baseline for most women, about 3%.
You could come on our show and talk with us all night long, but Angelina Jolie doing something like this, how much does this push the cause?
Right.
Yeah.
Absolutely, and I understand there was another celebrity today that came up with this.
So it just shows, that all women, doesn't matter, entertainment, celebrities, anything, anybody can carry this type of gene.
Absolutely.
All right, so it's important to get screened if you do have those
Talk to
early
your
warning
doctor
signs.
about it, and the thing is to see a genetic counselor about this if you feel that you're at high risk. Don't just get the blood test drawn because it needs to be drawn in the high risk population.
Big advancement, isn't this?
True. Huge
Absolutely.
advancement.
Thanks so much for being with us.